Doctors of Reddit, what is something that you wish everyone knew about their body? Some things just don't belong in your rectum. Edit. Woke up to a whole lot of upvotes, goddamn. This is a first for me. So not sure what to do with it, but thanks for the gold, and just to be clear, no, I'm not a doctor. Just a concerned citizen who's spent entirely too much time on the internet. That administering CPR compressions ASAP is one of the greatest indicators of successful outcomes. Vaginas are self-cleaning, and ouching does more harm than good because it flushes out all the good bacteria that's meant to be there. Edit. I made this comment at 2 a.m. and my eyes skipped over the part where it says doctors of Reddit. Oops. I'm not a doctor, just a person with a vagina woes tired of all the unhealthy vaginal misconceptions. Also, if you are going to wash down there, use soap without fragrance and clean just the outside. You need some kind of exercise. Doesn't matter how you feel right now, sitting for 12 to 16 hours a day will have negative consequences. This is going to sound really basic, but I wish my patients would know what meds they are on when they come to the hospital. At least once a day comes somebody in who goes, yeah, I take 8 pills in the morning, 3 in the evening, and 4 at lunch, but don't ask me which. You're a doctor, you should know. I beg of you, before going to a doctor that has never seen you before, write your meds, doses and all on a piece of paper. Don't do DE surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. How to check for skin cancer. If you see any moles or anything that are asymmetrical, B border, odd borders, like they're jagged or something, C color, different colors, D diameter, grows, E evolve, well, evolves. Go get it checked out. It might be skin cancer. You often will feel normal even with high blood pressure. It's often found incidentally. So don't wait until it gives you symptoms you don't want to go through. Edit. To all those wondering how to figure out if it's asymptomatic. Get checked at least once a year if you're over 35. Why? There's no other way. That the immune system is an incredibly complex and nuanced organization of cells that communicates readily to destroy anything deemed hostile within the body. It helps explain why vaccines are supposed to work, why allergies come and go, and why transplants are hard to successfully pull off. That they only have one in their behavior now, drinking, smoking, not taking medicines, or whatever, will impact their life quality and expectancy. Sounds logical, but very few patients really realize it. Where the orifice each gender urinates through really is. Antibiotics are not some magic cure for every pain in your body, nor for the flu or common cold. Never ever boil breast milk. In my country there is a popular belief that breast milk jaundice in newborns can be treated by boiling one's breast milk, but by doing this you destroy all the nutrients, and it basically becomes as nutritious as water is. Do not give honey to children below the age of 1. Do not rub your child with rubbing alcohol as to lower his furor. Baby wipes don't substitute daily bath showers. Yes, I am a pediatrician. I'm a dentist, and if you don't take care of your gums your teeth will fall out of your head and you'll get pissed at me when your jawbone atrophies and your denture doesn't fit anymore. Edit. Essentially periodontitis causes inflammation and recession of the gums, which in turn cause inflammation and recession of bone. After that, teeth start getting mobile and falling out. Drink water. Your mental health is just as important as your physical health. Type 2 diabetes is more serious than most people realize. I work as a doctor in hemodialysis, and most of them are due to diabetic nephropathy. It also affects your eyes, nerves, immune system, etc. Simple life changes can help you, but no one seems to care. I even lost 9 kilograms myself because I had a family history of diabetes and to be healthy. Edit. Wow, thanks for the silver stranger. I didn't expect this comment to be big, but please take care of yourselves people, because it is really sad for us doctors to see people get ill because of a preventable illness. Also, there are lots of good subreddits for people trying to make a lifestyle change. You and your body deserve better. Edit 2. Change diabetes to type 2 diabetes for clarification. Changed easy to simple. I wonder how many of these answers are from actual doctors. Not a doctor, but a trauma nurse. Motorcycles are fucking awesome, but they are also death machines. Don't ever get on a fucking motorcycle, but if you do anyway, wear a fucking helmet. You only get one body. The way you treat it has a significantly higher impact in how your health will end up in a decade than what sort of interventions we can give you. You really should treat your body like a temple. Edit. It's a saying y'all. If you want, treat it like a family heirloom, bonsai, or your favorite china. I'm a vet, but I'm sure some doctors will have come across this too. Amputated limbs do not grow back. I've had far too many people asking how long it will take for their pet's amputated limb to grow back, so I'm assuming a few doctors out there will have had patients asking the same of their own missing limbs. Not a doctor, but this information could save a life. In an emergency situation where you are giving first aid CPR to someone instead of stating general instructions to the group of inevitable onlookers like someone call 911, someone get a defibrillator point, if able otherwise some other form of direction, to someone and say, you call 911 and you find a defibrillator. This prevents the bystander syndrome where people think someone else will probably do that and gives clear instructions allowing for a more efficient process where literally seconds could mean life or death. Teeth are the most disrespected body part. A healthy set is as important as a healthy heart. Infective endocarditis is a thing too. Edit. My patients also don't seem to realize that healthy and clean teeth makes you look much younger than you actually are. Some people seem to think that if you act healthy for a bit, it'll make up for being a wreck. There are so many things wrong with this. Just one example: antioxidants are like gas for your car. You can store up a certain amount of vitamins, but your tank can only hold so much. If you binge and overfill your tank, it doesn't do anything, you excrete it out as waste, and you can't expect to go the next several months without gas just because you tried to overload it before. You're going to still need to get gas. Same goes for your fruits and veggies. Had someone tell me he went vegetarian for a few weeks, which meant he was done for the year. He was dead serious. Had a patient at risk for heart failure try to insist that if she stayed away from salt entirely for X days weeks, she should be able to have her fill of McDonald's fries and ramen. Had a smoker argue that if he stopped for some time, he should be able to smoke freely for a while. With some digging, stopping turned out to mean a couple less cigarettes a day. Deleted. I'm not a doctor, but as someone that works with those who may be in a psychotic break. Get sleep. Most psychosis happens because someone haven't had slept or haven't had good sleep for extended periods of time. Some people just need 20 straight hours of sleep and then they never end up in a psychiatric hospital ever again. And don't just randomly stop your medication because you feel better. You feel better because you have consistent amount of whatever is leveled in your body now. And now that your body is hitting equilibrium, everything is going great, so keep doing what you're doing. I've seen people go on and off their medications for years, and it really starts to mess up your body if you do that for too long. Sorry, I know I'm joining late, I had to make an account. Actually a doctor. I wish people would know that when I say, I don't think CPR is in your relative's best interests, I am not saying I am going to withdraw all treatment immediately. CPR is brutal, and it has a much lower success rate, even if done promptly in hospital, than the movies make out. If you are old or have a lot of medical problems, then the success rate goes down even more. If I don't want to do CPR on you, it's not because I want you to die, it's because I don't want to fracture your ribs, expose your body to a huge group of people you don't know. Everyone loves attending a crash call and repeatedly assault your dead body for nothing. I want you to die with dignity and care if there is no chance of bringing you back. In summary, CPR is great and everyone should learn how to do it, it does save lives. But, if a doctor suggests it should not be performed, please give serious thought to that. We don't suggest a DNA CPR for no reason. Not a doctor. But I'll do have some advice. If you're ever short of breath and it's unexplained not running while being a fat smoker like me, go see a DR. Now. For about 4 days prior to this past Christmas, 2018, my wife, F29, was short of breath and felt generally crummy. We didn't think it was anything but a cold, allergies, etc. Christmas Day she felt worse, didn't move much. So I told her that if she doesn't show improvement by the next morning, 12/26/18, yes, the dates are important, you'll see why, that I would be forcing her to go to the ER and get checked out. She didn't have any improvement. Only worse. I took her to the ER around 4 p.m. that day. When they took her back and got her hooked up, she was at 40 to 45% O2 saturation. Which is bad. She was then sent by ambulance to the nearest hospital with an ICU. For any Dr. S in the house, there was about a golf ball size part of her lungs that showed black on the X-ray, the rest was white. By 10 p.m. that day she had dropped to 10 to 15% O2 saturation and was immediately put on a ventilator and was kept asleep for 2 weeks. She was, at most, a few hours from dying. She had pneumonia and sepsis in both lungs. Due to the amount of meds they gave her and being dehydrated already, her kidneys took a hard hit. She had dialysis 6 times in the hospital. After 37 days in the hospital, 14 of which she was in and out of consciousness, she remembers not being able to talk and trying to write some stuff on a paper. She was released. Last week, July 1st-ish, we got blood work back that her kidneys were finally back to 99.6% function. Edit: the good news is that at our local hospital you can check into the ER online and they'll take you back pretty much as soon as you get there. Even though I'm pretty certain they would have done that not having checked in. Alcohol is really bad for you. I understand that ritualistic consumption of the poison has been part of almost every society for thousands of years, but that absolutely does not change just how terrible it is for your body. You may think, I binge drink all the time and I'm fine. I come from a long line of heavy drinkers. It's just some booze, I've never gotten sick from it. But boy howdy, do you not realize what it does to your body. By binge drinking, you run the risk of developing stomach bleeds, intestinal bleeds, pancreatitis, both acute and chronic, liver disease and/or liver failure, alcoholism, heart failure, seizures, stroke, osteoporosis, lung failure. The list goes on. Every time you have more than a few drinks in a night, you are essentially juggling hand grenades hoping that they don't go off. There is just no reason to do that to your body. Having 4 drinks spread out over a few hours can be just as fun as having 10 drinks in the same time span, and you're not putting yourself at risk for massive organ failure and making yourself look like an idiot. Disclaimer: not a doctor. Was an alcoholic, got very sick from alcohol, suffered serious organ damage from it, am now sober. Baby doctor here, about to graduate. Unless you have liver or kidney failure, your body detoxes itself really well. Don't get scammed by these detox teas and whatever. Edit: I mean that I'm a baby cause I'm just starting out, not that I'm a doctor of babies, just to be clear. I won't specialize for a while yet. That the large majority of the population's mouths have the capability to shut. Obviously not a doctor, but I work in an emergency room. We aren't going to call the cops if you're on drugs, we need to know so we don't give you medication that when mixed with said drugs will kill you. Example? If you're high on heroin, a depressant, and you're flippin' out, we can't give you Ativan or Benadryl cause it can literally stop your breathing and/or heart. Take care of your kidney. If your renal function is shot, it closes the door on so many options. Edit: a lot of people asked about how to take care of your kidneys. I suppose this just shows that we need to learn to take care of all parts of our body more. The most important thing is to care for your cardiovascular health. Healthy arteries and healthy kidneys are strongly correlated. For most Americans, this would require an adjustment to their diet and lifestyle. Most people would also do well to increase water consumption and reduce salt intake. If you have diabetes or SLE, your kidney health pretty much determines your expectancy, so have a conversation with your doctor. Other than this, regular self-examination and health examinations can be very beneficial. Changes in urinary patterns? Bubbles in your urine that won't pop? Does your urine smell sweet? Talk to your family physician. Do you have a family history of PCKD or Whatnot? Think about getting regular ultrasound examinations of your kidney every few years. Having wet hair in a cold room will not make you sick. We know you didn't slip and fall into that cucumber other phallic object. I am not a doctor, but I am taking a physiology class, and our instructor, who is a doctor, gave everyone an extra credit project where we learned that wearing high-heeled shoes contributes to osteoarthritis of the knee. So I assume that would be her answer. High blood pressure doesn't have symptoms majority of the time. It's called the silent killer and causes a plethora of other illnesses. Asses aren't food. My phone is acting up, so if this has already been posted I apologize, but women, please do not use soap or douching products inside your vagina. It has a delicate pH balance, and this is how you get yeast infections. Wash your labia, but do not clean internally. The vagina is self-cleaning just like your eyeballs. Do you wash your eyeballs? No. Do you wash your face? Yes. Your kidneys and liver cheerfully do all the toxin elimination you'll ever need. Cleanses and other detoxifying products are bullshit woo and a waste of money. The people who sell them are predators who only care about your money becoming theirs.